Hi, this is Josh Nerenberg, licensed acupuncturist, and I'm here at my clinic, San Diego Cosmetic Acupuncture, to demonstrate microneedling for acupuncturists on Natasha. So before starting, we're going to go over some of the different things we're going to be using during today's treatment. Make sure when you're setting up your areas to have a clean field. Just like acupuncture, we want to have our area sterile, and we want to have a sharps container nearby, since any needles that we're going to be using, we're going to be disposing in the sharps container. As you can see here, we have our clean field where we have our AcuMicro pen. We have a bag of 12 microneedling cartridges. We're going to go over nanoneedling today. We have our cleansing wipes, our cotton balls, which we're going to be using during advanced microneedling and treating more deeper issues. And then we pre-made our serums that we have gone over in the lecture. So here we have pre-made 20% apple stem cell. We have Oculus here, pre-made. Lumos. And hyaluronic acid, which is going to be the main thing we're going to use as a medium during this treatment. All of these serums have been pre-made to a 20% dilution. We used hyaluronic acid for the apple stem cells to dilute it to 20%, and vegetable glycerin for Oculus and Lumos to bring those to 20% as well. The next thing to make sure to have is gloves. Unlike acupuncture, we actually need to use gloves during this treatment. It is required to, so make sure you have a fitting glove. The last thing we're going to be doing is using red light therapy after and before the treatment. That helps increase collagen, and we'll show you how to do that in a second here. So to start, we're going to always prepare our patient by sterilizing our area, put on our gloves. And it's optional to use numbing cream. Some people prefer it to use it during a first treatment if a patient is sensitive. I technically, on most patients, don't use it just because the treatment itself is so gentle, especially when you're doing a 0.5 millimeter depth, that the patient usually doesn't feel too much from any of this. But for this demonstration, I'm going to show you guys how to do that. If you're using any kind of numbing cream brand, usually you want a 4% lidocaine at least, and you want to use about a quarter size. A little bit goes a long way, and you can put this on the gloves. And simply massage the areas that you're going to be treating on the face. And you're going to want this to sit for between 20 and 30 minutes before the treatment. Now, since we have her numbing up, and we're going to be doing the chest area a little bit too, it's a perfect opportune time to use the red light. So we'll put goggles on and use this as a staging time to operate and use the red light therapy with the AcuLight. So we simply want to turn it on with full power. Set the minutes for about 20 minutes. The highest frequency and the highest power that we can turn it up to, so that we don't get intermittent light. So we're going to leave Natasha here for about 20 minutes. We want the red light to be between 6 to 12 inches away from whatever area you're treating. After about 20 minutes, we're all set to go and ready to microneedle. So we're going to turn off our red light. And use our microcellular wipes to clean the face and prep the area, as well as take off that numbing cream. I like to use something a little more natural. As you can see here, I'm using Simple for sensitive skin. Make sure you get all that glossiness off before you start with your treatment. After you've cleaned and prepped your area, you are ready to microneedle. So to set up your microneedling pen, it's pretty simple. We're going to insert a microneedling tip, which is gas sterilized, so they're one-time use only. We want to use only one of these per patient. After you're done with this treatment, or whatever treatment you're doing with your patient, this needs to go into the sharps container. I simply pop this out the back, and do it this way so you guys can see a little better. And if it doesn't go down, you can be forceful with it. You want to just press it all the way down until it's at the bottom, and then you just give it a little half turn to lock it in. So I'm going to press down, turn, and that locks that piece in. To undo it, we're going to show you this way. I half turn it the other way, and it comes out. Again, you can be forceful with these pieces. Make sure you're going all the way down, and you give it a quick tug on the top, but to make sure that it is locked in before you start your treatment. On the dial here, you can change and turn your dial to make sure you're hitting the exact same depth between 0.5 millimeters all the way to 2 millimeters on the pen, and that will determine how far this needle goes into the face for each rotation. Right here is our power button, so to turn this on, you just hold it down until it turns red, and that will turn on the pen. If you hit the button, it will turn different colors. You don't want to actually use any of the other colors. That will slow down the speed of the pen. Kind of ruining what makes this pen so special is the high RPMs. So we want to keep it on red at all times. And to turn it off, all we simply do is hold that button again for 2 seconds and it turns off. The AccuMicro pen does come with multiple batteries, so if you're charging batteries, you're going to charge it in the port in the back. You can unscrew it by taking off the back piece here and putting on another battery. And I would say one battery usually lasts me about 6 to 10 patients, but I like to have other ones charging, just like electronic toothbrush or something. You always want it to be on full charge, just so you're getting the best results with these kinds of products. So now that we're all pretty much set to go, the face is set to go, we are going to set our pen to 0.5, and this is going to be the main depth we're going to use throughout the treatment. Is 0.5 millimeters, and you can see that right there. I dialed it in at 0.5, and that simply means that this one on will hit into the skin at a 0.5 depth into the skin each time it rotates, and about 18 to 19 rotations per minute. The other thing you'll notice on the tip up here is there's a gap. AccuMicro has anti-backflow technology, so none of the serum will get sucked back into the pen. Keeps the pen really clean, and in between patients, make sure to rub this down with rubbing alcohol just to keep your area sterile and clean throughout your treatment. So to start our treatment, we're going to use hyaluronic acid as a medium throughout this, and I prepared this in a larger container. This is actually from AccuMicro, and I bought the container on Amazon, so it's easy for me to use my fingers and guide my pen with my other hand. So I'm going to have you turn your head to the side, this way a little bit. Perfect. And we're going to start on the cheek with a basic technique called the crosshatch pattern. So that we have more room, I'm going to move this a little bit out of the way, and I'm going to move this so I have a space to work on. Now, you can also use a dropper when you're using the hyaluronic acid. I personally just like to dip my fingers in there and place it. It helps guide things a little better for me. But when doing these, I like to use plain hyaluronic acid with no additives while microneedling as a medium. It's not going to be until after the treatment that I'm going to use the AcuMicro serums. So to start, I'm going to dip my finger, turn the AcuMicro pen on, and place a little bit on her cheek. The first movement we're going to go over is crosshatch, and for that you're pressing down just a little bit so that you have contact with your skin, with the skin, and you're just going to go back and forth, back and forth. Once you reach the end of the point where you're treating, you're going to go perpendicular and you're going to come back like a checkered pattern, back and forth. And that after 2 passes, we're going to go back to the main movement that we were doing before. If the cheek or any area that you're treating gets dry at any time, don't be afraid to use too much hyaluronic acid. You really can't use too much. Your skin will absorb it so fast while treating this that most likely you're going to have to keep reapplying. So you're going to see I go the same movement up and down again. And for the last pass, I go side to side, side to side to equal 4 passes. So every time I'm doing crosshatch, I'm going to do about 4 passes over any area that I'm treating. A lot of people question if redness is equal to doneness, if the patient should look red or if they should wait and do treatment until the area is red. And I always respond that people have very different skin types and everyone's going to respond differently to this treatment. So while you can use redness on some people to see areas that you've gone over, I'm not going to recommend using that since some people will not turn red at all from this treatment. The next thing we're going to show is circling or stirring. So we're going to place a little hyaluronic acid on the chin. I'm going to have you sit, turn your head forward. Thank you. And this is perfect for small areas. Chin, sometimes I'll do this on the cheek, and this is exactly as it sounds. You're using a 0.5 depth, and you're just very lightly pressing down and circling over the area that you're treating. You want to go over this area just like with crosshatch, around 4 times. So cover each area around 4 times as a general rule of thumb. I'll sometimes use that as well for these nasolabial grooves right here along the face, and that's a good way to circle and treat those. Go down with a little more hyaluronic acid and have a little circling on, stirring on there. The next technique that I like to go over is scrubbing. So with scrubbing, we're gonna do this on the nasolabial grooves right here because I feel like that's a really good area to demonstrate this technique. It's exactly as you would think it sounds, much like using a pencil eraser. You're kind of trying to erase those lines. So you're gonna go over those areas, press down a little harder, still a 0.5 depth, and just scrub at it so you can really address those wrinkles. I really like to do this on specific lines, like if there's a line over here, I might scrub or go over that specifically. And another area I'm going to do at the end that I like to show with this is the forehead. Since the forehead is skin on bone, it can be very sensitive for a lot of people. So to treat the whole area, it's a lot easier a lot of times to just use scrubbing over specific lines, which I'm going to show you guys at the end here. The next area we're going to treat is the neck, and I'm going to do a little bit of all the techniques on the neck just to show you how to use these kind of in a freestyle way. You don't need to feel like you have to do crosshatch necessarily everywhere or spiraling. You can choose what you want to work on what area. And I'll do a little circling on here, spiraling, and maybe a little bit of scrubbing along the neck. The main thing you want to go make sure is that you're not overstimulating the skin You're not going over it more than 4 times. The patient isn't in any pain. You're not going at anything more than a 0.5 depth unless you're doing something specific. Again, I'm going to do a little bit of crosshatch first. And I always say gentler is better. Just, you want your patient to be comfortable. That's the most important thing. Since we did 2 movements of crosshatch, I'm going to come back and do a little bit of circling here, or spiraling. And then I'm going to scrub over a few of the lines with a little bit more hyaluronic acid. This should be slick, or whatever we're treating should be very easy to glide over at all times. If the pen isn't gliding, it's just a sign to always add more hyaluronic acid. So we're going to scrub this area. Perfect. And a little circling. Now this can look a little unorganized and sometimes on certain areas such as the neck, but as long as we're going over the skin 4 times, whatever technique we're using, it's going to have a really great effect and get that hyaluronic acid and whatever herbs we're going to use at the right layer in the skin. So we're going to move to the décolleté area. This is a great area on here on the chest just because this is an area that's really hard to treat with a lot of other modalities. And the décolleté area, as I was saying, is very hard to treat using other modalities. So patients are really thankful when you do these, when you're able to treat these areas with microneedle. Same thing goes for the back of the hands. I'm going to go over just a little bit more. And when we do larger areas such as this or the back of the hands, make sure not to move too fast. You want to be moving about 1 inch per second at the fastest. Usually I recommend slower, usually about 1/2 inch per second. Perfect. Okay, so next we're going to move to more of the upper face. We're going to do the upper lip, which obviously is going to be a little more sensitive since we have some of those sensitive dew points along there. We're going to do the sides of the eyes and the forehead. So with the nose, I always like to use spiraling. And to do this, I simply just hold the nose so there's not too much vibration. You don't want your patient sneezing or anything. And a little bit of circling with either a 0.25 millimeter depth or 0.5 millimeter depth. Works great for blackheads. Just really good on rejuvenating the nose area. Make sure, however, not to treat the tip of the nose up here. That's obviously a acupuncture alarm point, so it will make your patient jump off the table. As I said, hold the nose at all time for the vibration and just simple circulation around it. For working on the eyes or any wrinkles that we're going to be going across, we always want to spread the wrinkles so that it's flat. So we're going to put a little bit of hyaluronic acid on that area first, and we're going to use this hand to flatten our area so we have a flat working surface and do a little bit of spiraling on that area. We usually want to move kind of quickly since this area can be pretty sensitive, but it allows us to treat it, the area in its entirety without, getting your pen, hitting all the areas your pen can trip over. We're going to switch to the other side too. We'll put a little hyaluronic acid on there. Use this hand to open up and flatten any wrinkles. And just use a little bit of spiraling. It doesn't need too much. But always make sure you have bone underneath you. When you're microneedling, make sure that you're not going inside the infraorbital ridge. You're always on bone. You can tell by pressing down, and if you can press down, that's why I like to use this hand as a guider to make sure you're in the right area. The last two that I save for last are the top lip and the forehead usually, just because, as I said, they're a little more sensitive. If need be, I can always go down to a 0.25 millimeter depth with this pen, or switch to a nano needling tip for less sensation. But you have been an amazing model and have had no twitching at all. So I can show you guys here. We're going to spread this area a little bit and we're going to just quickly scrub. We want to do it really quickly so they don't have to feel too much. And again, you're going over it 3 to 4 times and done. And the same thing we're going to do with the forehead. We're going to place it on the specific areas we want to treat, those wrinkles, rather than maybe treat the entire head. And we're just going to quickly scrub over that 4 times. You okay? Mm-hmm. Awesome. And every time you're needling, feel free to just keep layering hyaluronic acid on. It's just going to keep absorbing. It's cooling. It makes it more comfortable for the patients. To move forward, I'm going to show you guys a few other techniques, more advanced techniques. But usually it's at this point I like to finish up by applying serum. So this is when I use the 20% diluted apple stem cells or whatever serum you're going to create. I'm going to actually take this off and put this in the sharps container at this point, since we are done with it. And this is a perfect point to give kind of a facial massage. So we're going to take our apple stem cells now. And whatever I'm not going to use, I prepared this specifically for her. I'm going to send her home with this to apply and keep applying on throughout the day. This is probably one of my favorite of the AcuMicro serums. I do mix it with other things like collagen and elastin, like I go over in the lecture. But using it straight after on its own at a 20% concentration right after treatment works amazing. And when you're massaging, it's always kind of good to go in an upward lifting motion. As we've learned in massage class and facial rejuvenation class, quick movements, upward motion, and make sure you get enough serum to absorb. Now, patients a lot of times will question once they get home. When this dries, a lot of times it makes it look flaky or like your skin is peeling. I always tell patients to expect this. It's not their skin peeling, it's just the product drying. If they simply add a little water and rub it in, it will reintegrate it into the face. So at this point, if I'm not doing any other further treatments, I will put on an aloe mask and let her sit for about 10 minutes, and that will cool her face, ending this part of the treatment. So we're going to show you that part right now before moving into some more advanced techniques. I like to keep these aloe masks usually in the refrigerator. It keeps them cold. So at this point, the patient usually says their face feels a little like sunburned. It could sting a little bit. There's usually not too much of any complaint, but as soon as you put this on for 5 minutes, and if you keep these cold, I rarely have a patient leave that's in any kind of distress or pain or anything like that. It's pretty gentle. So, and in my lecture, I show you guys how to make these on your own so we can make these a little more natural. But if you're in a hurry, they're very easy to buy. I like Burt's Bees. They have a very natural, good aloe vera version. So we have the rest of these apple stem cells we'll send her home with. She's had red light therapy. We did all the techniques for microneedling. Then we finished with a aloe mask. And yeah, we'll leave her here for about 10 minutes before showing you guys some advanced techniques to do microneedling on. So after about 10 to 15 minutes, we're ready to take off the mask, and this will be the end of our treatment. I do want to remind everybody, if this is the basic treatment that you're doing, I did this treatment very fast for the video. Take your time when doing this treatment. I always recommend testing it first on yourself so you know what it feels like on your own face. And then when you're doing your first treatment on your patient, you'll be more comfortable with these modalities and can work at a faster pace. So we're going to go over some more advanced techniques if you're working on a patient on other types of issues or focuses. We can use some of the other AcuMicro serums. We're going to be using Oculus and Lumos, which we've diluted down to 20% using glycerin. Now we're going to start with Lumos. This is great for spots, lightening skin, and works as a natural seaweed that we use with a technique called sparrow pecking. So first of all, we're going to use a new tip for this. If this is part of your original treatment, you can keep with the same tip, but since we have been using a different pen for shots, we're putting on a clean tip for this. We're going to set our depth to 1.5 millimeters, between 1.5 and 2. You can go all the way up to 2, but I'm going to set it at 1.5 for this technique. We want to choose an area either with scarring or spots. For now, we're going to use, we're going to specifically treat spots for, with sparrow pecking. And you're going to find an area with a little discoloration. We're going to do this one here for now. We're going to get our Lumos ready. And we want to put a little bit of Lumos on the spot before we sparrow peck. And then all you have to simply do is dab at that area between 4 to 6 times. So you'll see me very quickly dab, 2, 3, 4, 5, 6. And you can see here, a little bit of blood sometimes will come up. That's completely normal, and it's a lot of good times to have, there's a good reason to have cotton balls on hand, but not a lot should come up. So a lot of times I'll clear that out with a sterile cotton ball and put in a little more Lumos on that area so that it gets in at that deeper layer. What is actually happening is the melanin is coming up and leaching from the deeper source and coming out while we're putting the Lumos, or the natural seaweed, on the area that's going in and helping balance that melanin pigmentation. This works on spots anywhere. I've worked on the hands a lot of times and works very, very well. It can take anywhere between 4 to 6 treatments to see changes with spots, so don't expect results always right away. But with time and multiple treatments, spots are very effective to treat this way. The next thing I'm going to be going over is called linear trailing, and this is something we do, or we call it also aerating the crops. And this is something we do for hair growth. So for this technique, we're going to move it to a 1 millimeter depth. You always want to be doing a 1 millimeter depth when treating the hair. We're going to go ahead and use our hairspray. It's a witch hazel alcohol base mixed with herbs, so it works very well for sterilization. And we're just going to give the hairline a few sprays to prep it. Now to treat, we're not going to actually treat the entire scalp. We're just going to start from the top in the front and move to the back. And this is actually the least sensitive of all the areas for some reason. You would think this would be more sensitive. And in between each line that you're drawing, you want to leave around about a ½ an inch distance. You're not microneedling the whole head. You're just drawing lines so that these herbs can get into the scalp at an even rate. Just like the rest of the head, or the rest of the face, you're going to go over this 4 times. I'm on my 3rd. This is the 4th. And if you're treating the scalp, you can actually do this treatment twice a month rather than once a month like the face, since you're not treating the entire scalp together. Since you're leaving about a 1/4 inch space in between your lines, when they come back anytime between 2 to 4 weeks later, if they're treating the scalp, you want to start at the area you did not start and do those lines in a separate area. At the end of here, We're going to finish by simply spraying the herbal spray again to make sure that it gets in. As a separate treatment in itself, or by adding it onto a treatment, a microneedling treatment you're already doing, you can add nanoneedling as well. Nanoneedling is the exact same as microneedling. We're doing pretty much the exact treatment. The only difference is the needles are microscopic, so there's actually no sensation. It almost feels like a facial massage. So again, these are in gas sterilized, one-time use. You need to switch these between patients and put these in the sharps container, and they lock in and go in the same way as the microneedle does. With nanoneedling, you always want to have it at a 1 depth. That's just pretty standard for nanoneedling all around. That's just so that it's hitting in the same area every time. You can, however, change how hard you are pressing with the nanoneedle, which can affect your treatment in different ways. So with the nanoneedle, we're going to hold this on, and that will turn it on just like with micro. And we're going to, same way, use hyaluronic acid as a medium if we're treating any areas of the face. This is a perfect tool to go to if a patient is sensitive with microneedling. You're able to dial down on the microneedle to give them less of a intensive treatment. And if they still are feeling uncomfortable, you always have these nanos to go to, which all patients pretty much can tolerate. It's very, it's almost like a gentle facial massage. This also lets you do a few other treatments as well, such as using Oculus, another serum that AcuMicro provides. This is diluted to 20% using glycerin, vegetable glycerin. So it's pre-prepared and pre-diluted. And this allows us to do a technique called tracing. And we're simply going to place this around the area that we can't go with microneedling, inside that infraorbital ridge, maybe a little bit on that eyelid. So those areas that are really hard to treat, but with this modality, it can be really simple and gentle. So don't be afraid to make a mess, as you see I'm doing right here. More serum is better with this, since you want to glide. Like a pencil, all you simply have to do is trace, like you're putting on eyeliner, around the area that you're treating. And you're going to come back, same way. And you're going to do just like the others. You're going to do this about 4 times on each eye. And this is called tracing with Oculus. Oculus is another seaweed. We'll talk about it in our lecture and how it works on bilirubin, getting rid of those liver enzymes that build up underneath our eyes and cause those dark circles. It's also good at repairing lines and wrinkles under the eyes as well. The serum, when you're using it with glycerin, can be a little more greasy and less absorbent than hyaluronic acid. I just want to let you guys know that. It's a little harder to work with, but when you put hyaluronic acid with either Lumos or Oculus, it will easily clump up since it's a seaweed. So I find it easier to work it and dilute it with glycerin rather than hyaluronic acid. But I have honestly done it both ways, and both ways have been shown to be effective. With our nanoneedle, we'll just finish up here just a little bit on the top of the lip. Like I was saying before, since this area is so sensitive, it's such a good area to save just for nanoneedling. You can come on here, it feels kind of like a massage, and you can easily go over those dew points or some of those nose sensitive points that you might have missed with microneedling. And that allows you to treat the face more in entirety rather than have to skip different sensitive spots. So now that we've finished our treatment in entirety, a lot of people like to add red light as well at the end of the treatment. We have here 2 different types of goggles. We used these earlier. We'll use these glasses. It honestly doesn't matter. On Amazon, there's a lot of different styles on there. Just keep them sterilized and between patients, and they're all pretty much the same. So we're going to keep this light about 6 to 12 inches away from the face. We're going to turn it on red light. And if you're interested in the different color spectrums, definitely look into the AccuLight class on AccuMicroLight. There is different reasons for different spectrums, but today we're only going to be using red. We want to turn it to max power and max frequency so that there is not blinking or intermittent light. Make sure that this is the right height. And we set the timer for between, I would say 10 to 20 minutes is usually what I add on at the end. Again, this is great for ending a treatment, making sure those pores are closed. It adds and allows collagen to reproduce at a 200% increased rate according to studies. So it's a great addition for all those microneedling trauma that we just created and really starts the patient on the path of rejuvenation. Make sure to go over their aftercare sheet and what to expect after the treatment, so both you and your patient have communication between that and they feel informed and have the right products or tools as they go home. This is Josh Nerenberg, licensed acupuncturist. I want to thank you for joining us today and learning microneedling for acupuncturists here at San Diego Cosmetic Acupuncture.